Many schools don't really allow students the opportunity to have interactions with patients until their third year, and especially there's not like a community medicine program. I believe we're one of the only schools in the nation to actually have a department dedicated to community medicine. Community medicine is spread out throughout your 4 years. You do it your first year, your second year, and your fourth year, and each time you're coming to the same community, a rural community here in Georgia, and you'll spend time, usually about a month or so. I think the first year is a little shorter, but it's about a month during your second and fourth year. And so you're having the opportunity to work with the same physician, work with the same patient population. And so you're doing that aspect of it in terms of getting clinical experience. Well, this is actually my second year with Dr. Brown as part of our community medicine program. I actually spent a month with her last year, and now I'm back again next year, maybe a little bit smarter, a little bit more dangerous.
The one thing I do like about the program is I get to see students their freshman year when they're kind of a little timid about touching people and doing things, all the way to their senior year where they've had their clinical experience, and I could just see how they blossom as physicians. I try to make sure that they see a wide variety of patients, because this is a family practice. And I'm not looking for them to make some brilliant diagnosis or whatever. I just want them to have the fundamental basics of medicine.
Each little community has their own major healthcare issues. They have their own major barriers that they have to overcome. And I think for the student who's maybe from Atlanta originally, or a bigger city or town, and hasn't had the opportunity to experience rural health or be in a rural community, this is a wonderful opportunity for them to come and see what the patient base is like, for them to understand, you know, what rural life is all about, and that, you know, there's life here in each and every one of these communities. And it's been a great experience. I know that when I go to the hospital, you know, here at the end of the month and I'm working with patients, I won't feel awkward or weird about going and talking to patients, because I've been doing it for the past 2 years. I've had that experience already, and I can feel confident in my ability to interact with people. A lot of medicine is just talking to people. A lot of it is talking and being able to communicate well, and also understanding that a lot of the information you get is just from listening. I think that's probably one of the biggest lessons that I've learned, is just by being a good listener, you can learn a lot about what's going on with your patients.